Okay, I have learned a very valuable lesson in that I should never give odds when speculating on whether or not we'll need a talk show. Because just hours ago on our morning report program, I speculated that 50-50 that we'll need to do something. There's some stuff, but is it really, does it need a show? No, there is now a gigantic, I don't know if you can hear it, gigantic pile of stuff to deal with, and we, of course, are happy to do so on this edition of the Town Meeting Talk Show, sponsored by Cordova Wireless Communications. They are your local cell provider, providing your local talk show and keeping those hard-earned and sometimes, in these days, potentially hard-to-come-by dollars in town. So having those circulate through our local economy is very helpful. You may know of those, those financial models that say every dollar that stays in town changes hands about 7 times. So, that's a big deal. Plus, along with CTC, they bring in a whole bunch of outside money that then gets pumped through the economy. So, we really appreciate their support. And like I said, there's a lot to go over here, so you are welcome to brew some coffee and ride along with us. We're going to start with the City of Cordova's latest news release, which has quite a bit of new information in it. And it says that we still have a confirmed positive case count of 0. Always nice to be able to share that. This, by the way, this document is on the website. This is news release number 15, came out yesterday at 5. And cityofcordova.net if you prefer to read it rather than hear it. So the first thing they've announced is a playground closure. Effective immediately, the City of Cordova Parks and Recreation Department has closed all city-owned public playgrounds, including the Mount Eccles Elementary School playground. They are considered high-touch zones, are open 24 hours a day, 7 days a week, and resources are not available to keep all surfaces disinfected and ensure public safety. So they want to avoid little hands touching things and then other hands touching and spreading and so forth. So again, that's an immediately effective closure of all city-owned public playgrounds. An update on testing in Cordova. As of yesterday, there have been 11 COVID-19 tests conducted, with 0 positive results. There are currently 0 tests awaiting results. Local healthcare providers have the capability to test approximately 300 people in Cordova at this time. Additional testing supplies have been ordered. More tests have not been administered because individuals have not been sick enough to meet the CDC guidelines for testing. However, in this next section, they talk about the possibility for upgrading that capability, and that comes under the heading of Rapid Testing Machine. The Alaska Native Tribal Health Consortium, the ANTHC, that's the statewide organization that runs the Alaska Native Medical Center in Anchorage and works with smaller tribal health organizations across the state, on Monday announced it had purchased 40 ID Now COVID-19 rapid testing machines and 2,400 test kits for diagnosing the virus to rural Alaskan communities. The machines, each with 48 test kits, would be provided to tribal health organizations for distribution among local communities, according to a statement by the Tribal Health Consortium. ANTHC clinical directors met Monday morning and agreed to the proposed distribution plan, which includes 1 machine for the native village of Eak's Elonka Community Health Center. Distribution of the analyzers and test kits to the region is expected to begin immediately. Early and broad testing for COVID-19 has been shown to help isolate cases from becoming more widespread throughout a community. However, it's important to note that only a small number of tests are being sent with the machine, and test resupplies are controlled and distributed by federal and tribal governments. doctors plan to continue following the CDC guidelines for testing in Cordova at this time. And what they mean by that is, as you may have heard, the CDC is established because testing supplies are limited. They want to see people have a certain level of symptoms before they expend one of these tests, which is likely to continue to be the case until somebody comes up with a way to quickly and effectively and affordably, and whatever the parameters are, to just be able to test anybody that wants to be. So for the time being, they need to save it for people who are showing symptoms and ask everybody who's not showing symptoms to continue to stay home, now to wear masks. Again, wearing homemade masks is recommended, as I'm sure you know, for everybody, period, whether you're showing symptoms or not. And staying at home unless you're doing something that's legally considered essential. So again, even with the new machine that has the faster turnaround, they're still going to test people per the CDC guidelines. Continuing with the text here, your Cordova Medical Response Team would like to reiterate that social distancing is still the number one method for containing the spread of COVID-19, and they'll update the public as soon as they learn of any changes regarding our ability to test. And I would personally like to reiterate that masking should not make anybody feel more empowered to be out and about any more than if masks weren't a thing. If you cut down on your social distancing because you're wearing a mask and think, oh, I've got the mask on, that means I can do more stuff. No, please don't think that way. Because that won't help. And remember, too, for any action somebody takes that does not help flatten the curve, that just lengthens the amount of time that all these mandates and restrictions stay in place. If we isolate now, if we follow the rules now, they'll be able to release us from the new rules sooner. But if people insist on ignoring these guidelines, then the guidelines are going to last longer. So I hope that'll work out for everybody. Now, next item in this news release says Incident Management Team Growth. As this incident develops and planning progresses, the Cordova COVID-19 Incident Management Team and City of Cordova are exploring avenues and forming teams to expand their efforts. One of those items, Mike Hicks, has decided to stay on as police chief for the City of Cordova beyond May 1st, likely through the summer, to assure stability and support on public safety and law enforcement in Cordova. In addition to his continued role as police chief, he also joins the incident management team as deputy incident commander. One of his first duties in this role has been reaching out to the state public safety commissioner to review plans and guidelines for working on COVID-19 related enforcement in our community. Got to say, that sounds like pretty good news. And thank you, Mike, for postponing your planned retirement there to continue to help out. Next point, under Incident Management Team Growth, Dr. Hannah Sanders is expanding her IMT, that's Incident Management Team, IMT Medical Advisory Team, and has appointed Dr. Charles Blackadar as, if I'm saying that right, I'm not sure that I am, Dr. Charles as a boots-on-the-ground medical advisor in Cordova. Along with other members of the IMT, Dr. Charles will be reviewing all processor and large operator plans. So, doctor review of all the processor and large operator plans to ensure they provide a safe work environment and proper protections for the community. So it's not just going to be elected officials looking at those. There's the doctor's going to do it. That's encouraging too. Then special task forces are being formed under the operations section of the IMT to focus efforts on securing ports of entry, sheltering, coordinating with first responders and public safety, and enhancing communication to all populations in Cordova. The IMT's Commercial Fishing Task Force has begun meeting and is working to ensure clear ideas about how to manage Cordova's harbor and fleet as they arrive. also encouraging because that's been, of course, the big thing that people have been most concerned about throughout this. As we'll see when we go over the agenda here shortly and some of the letters that are going to be covered in a special council meeting, which happens today at noon, incidentally. We'll cover that in a bit. Now, the next item under the new city news release, which you can read if you like from cityofcordova.net. Small vessel and tender vessel plans. Members of the IMT's Commercial Fishing Task Force, along with fishermen and fisheries groups from around the state, have been collaborating with Discovery Health MD to create sample onboard procedures for catcher boats and tenders that will prevent the transmission of coronavirus when the salmon season gets underway in the coming months. Yesterday, Discovery Health MD released a reference guide including a draft procedures manual, a draft checklist for captains, a number of handouts for crew education, and a notice from the state of Alaska on the use of cloth masks during air travel. More information and the full document can be viewed at amsea.org. That's AMSEA, if you're not familiar with them, amsea.org. And more sample plans, including large vessel information, is available at ready.alaska.gov if you look for the link to the COVID-19 worker mitigation plan. So again, these things are falling in place, and people will still have varying ideas, as we'll see, on how to proceed with the fishery. But if you're wondering if work is being done, it very much appears to be. And the links, by the way, to these small vessel and tender vessel plans are in this document. They're embedded in the document that I'm reading to you. So if you download the document, this new press release for April 7th, it's news release number 15. If you download it, you'll be able to click through these links and it'll take you right there. But I've looked at these documents and they're beefy. So now, a reminder again about the community being kept informed. Oh, they say there's a new user-friendly Cordova COVID-19 website. I haven't looked at that yet. I'm going to have to. It says the city of Cordova has enlisted the help of a web designer to create a new page for Cordova's COVID-19 information with the goal of providing more information that's easier for the public to find and access. Also, translations. This has come up over the last few days in the chatter. The Cordova IMT Public Information Team has begun efforts to translate all official posted signage and daily releases into both Spanish and Tagalog, which I also don't know if I'm saying right because I haven't used the word in quite some time. The PIO team also plans to work with processors to ensure that translations of key information is available in all needed languages to keep their staff informed of COVID-19 mandates, guidelines, and developments. The daily radio updates. Mayor Clay Copeland and other members of the COVID team are hosting a daily COVID-19 radio update, which can be heard on the KLAM and the Eagle in the 1 p.m., 5 p.m., and 8 p.m. hours every weekday. Short program can include frequently asked questions and answers, as well as pertinent local, state, and federal updates on COVID-19 status and planning. And the archives of all those updates are available at youtube.com/Cordova TV. That's our YouTube channel. Also, something else we're doing on the radio is a frequently asked questions long-form program on Fridays that will be broadcast weekly with questions and answers gathered from what's being sent to Cordova Prepared at yahoo.com. And that, as I know you've probably heard many times, but can you really hear it enough? That's the main email address for corresponding with the incident management team. Cordova Prepared at yahoo.com. Now, they're not going to just take all those questions and only answer them on the radio. Everybody that sends something in can expect an answer to their question to be sent back to them over the email. But what we're doing with our FAQ sessions on the radio is finding some of the most commonly asked questions that cover sort of the larger topics and sharing those so everybody can have that answer. And as I understand it, and I haven't had a chance to check recently, but as I understand it, they're trying to post FAQ results to the website, their website, cityofcordova.net. So I'll have to check and see if that's happening. But if it hasn't happened, I know they're working on it. And then also the weekly news briefings that the city does on its YouTube channel. They stream it just like a city council meeting. And those happen Friday at 4. They're streamed live and then available at the city YouTube channel, which you can access through the city website at cityofcordova.net. They have a link for it. So on Fridays, you get the briefing from the city at 4 online, and then at 5 is the show that we do with the team with the questions and answers. And that's on the radio and eventually ends up on our YouTube channel. So that's all the new stuff from the city's latest news release. Again, if you want to look at this document, go to cityofcordova.net. This is the town meeting program, our talk show here on KLAM, brought to you by Cordova Wireless for April the 8th. If you're joining us in the middle of it and want to hear the whole thing, it will be archived on our YouTube channel, the Cordova TV YouTube channel, youtube.com/Cordova TV. Now, some things to go over from the state, including a new health mandate. First off, as of yesterday, the Alaska Department of Health and Social Services had announced that the total number of confirmed cases of COVID-19 in the entire state is 213. Yesterday, they announced 22 new cases, 10 in Anchorage, 9 in Fairbanks, 2 in North Pole, and 1 in Bethel. That was their first one. In fact, that news release says the Bethel case is the first for the Bethel census area and is associated with out-of-state travel. So that's somebody from outside of Bethel that brought it in. Alaska Division of Public Health staff are working with the Yukon-Kuskokwim Health Corporation to complete a thorough contact investigation. And they have got that person isolated and are trying to find out everybody that they got in touch with. A quote from Dr. Jacob Gray at Alaska Native Medical Center will apply for us as well when our testing capability is improved. He points out testing is confidential. Getting tested as soon as possible when indicated by your provider is one of the most effective, important ways to help one's community in preventing the spread of this infection. Practicing physical distancing and excellent hand hygiene will help prevent us from getting COVID-19. And being tested for COVID-19 can be very useful to the individual patient and the community. And by the way, if you want to look at state documents like this news release and the new health mandate, which I'll share with you in just a sec, coronavirus.alaska.gov is the address. It's a pretty easy one to remember. coronavirus.alaska.gov. Now, yesterday there was an amended COVID-19 health mandate put out by the governor and Commissioner Crum and Dr. Zink. And this regards COVID-19 Health Mandate 005, originally issued on March 19th. It required patients, providers, hospitals, and surgical centers to postpone or cancel non-urgent or elective procedures in order to help prevent the spread of COVID-19 and thereby decrease the overall impact on the Alaska healthcare structure while also preserving the personal protective equipment. Because the same stuff, obviously, that healthcare professionals need to do surgeries, it's the same type of gear, the gowns and masks and everything that they need to deal with coronavirus. Following ongoing guidance from the CDC that healthcare facilities and clinicians should prioritize urgent and emergency visits and procedures now, the state of Alaska is clarifying non-urgent or elective procedures that are to be postponed or canceled under COVID-19 Health Mandate 005. These actions can preserve staff personal protective equipment and patient care supplies, ensure staff and patient safety, and expand hospital capacity. So here's the update, the new text now in the expansion of this. Elective procedures. All patients, providers, hospitals, and surgical centers are required to postpone or cancel all non-urgent or elective procedures till June 15th of 2020 to decrease the overall impact on the healthcare structure and preserve the PPE. This would include pre-scheduled surgeries deemed non-essential. The mandate does not apply to surgical cases coming through the emergency room or for an existing hospitalized patient. The terms non-urgent or elective include, but are not limited to, the procedures described on Attachment C, which I guess we'll go over in a bit. Didn't realize I needed to download that. To the extent that the terms non-urgent or elective are not fully defined, the state directs each medical office, clinic, surgical center, and hospital to create a physician task force that will evaluate all proposed procedures and surgeries on a case-by-case basis to determine if they are non-urgent and elective or can be deferred, and the physician task force will make a determination on all borderline procedures or surgeries for each patient. This action, the state says, is taken with guidance from the U.S. Surgeon General Jerome Adams and the American College of Surgeons. It also says, following guidance from the CDC, all routine dental and eye care visits are required to be postponed. Given Alaska's distances and limited healthcare capacity, it's especially important to open acute healthcare beds for anticipated COVID-19 care and conserve personal protective equipment. The state of Alaska believes that delaying non-emergent procedures is a protective measure for both patients and the healthcare workforce and will better prepare us for the anticipated impact COVID-19 will have on our health system. We appreciate the public's understanding of this mandate in an effort to mitigate the impacts of this virus. Now, again, if you want to read that more carefully, it's at coronavirus.alaska.gov, and it's amended Health Mandate 005 on elective medical procedures. Now, let me pull up this list, and we'll get a look at what's on here. Well, I guess we would go over it if it was there, which it isn't. Well, maybe it'll come up sometime today. But I mean, you can probably use your imagination to determine, what's probably essential and what isn't. Now, so we'll just move along. Special city council meeting today, April 8th at noon via YouTube and teleconference. And public participation is invited by using, it says the public call-in number, 253-6202. The call will be placed on hold, then calls will ring through in the order received. Please hang up after you've made your comment. Comments limited to 3 minutes per call. And on the agenda is first audience comments regarding agenda items, and then there's some correspondence, and then there'll be an emergency response update from Heather Brannon and Paul Trumbley, which will include the new organizational chart. I thought it might be interesting during our time here to go over some of these letters that are in the packet, and we put, I'm sure there's a link to this agenda on the city site, but we put a link to it on ours, on our Facebook pages, actually, for KLAM and KCDV. So if you want to look at this agenda, because there are a number of letters in it and a lot of interesting perspectives. So let's go over some of these in case you don't have time to download it or would just rather hear it. And the first one is to the mayor from Admiral Bell of the Coast Guard. Good afternoon, Honorable Mayor Copeland. As commander of all the Coast Guard forces in Alaska, I want to extend my sincere appreciation for the hard work you and the Cordova City Council are doing to keep the residents of Cordova safe during the COVID-19 outbreak, including the Coast Guard families stationed in our newest Coast Guard city. One of these days, I will get there so we can officially, personally recognize you with your new title of Coast Guard City. For your awareness, the Coast Guard stands ready to serve Alaskans during this time of need, and the women and men under my command will continue to respond to search and rescue and other vital missions, to include the preservation of the maritime transportation system. We are, however, carefully evaluating what can be delayed and limiting personnel movement. I consider it part of our mission to help stop the spread of this disease. Coast Guard members are embedded through 14 different communities in Alaska. The welcome and care Alaskans show us is highlighted by the fact that Alaska has the highest number of actual Coast Guard cities in the country. We're proudly woven throughout the fabric of Alaska, and this is a great place to live and serve. During this time, my active duty members and their families in these remote communities are keenly aware of the pressures being placed on our finite medical resources as we look to work together on curbing the spread of COVID-19. I sincerely, that is, appreciate your efforts to keep all Alaskans safe. Keeping the lines of communication open is of utmost importance during this unprecedented time. Since I am unable to meet with you in person, since we are all maximizing our social distancing protocols, I would like to offer up a connection, or rather lifeline if needed, now or in the future. I believe our common goal of looking out for the people of Alaska should bring us together to tackle the toughest challenges. If there's something we can do from the Coast Guard mission box, please don't hesitate to reach out to me or my staff to coordinate a virtual meeting at your convenience. And that, again, is a letter to Mayor Copeland from Admiral Bell of the Coast Guard out of Juneau. It's always nice to know that they're ready and help. It doesn't come as a surprise, but that they're ready to help, it just, adds to the arrows in the quiver. Now, another letter that's a council comment. This one regards the airport, from Rita Spann. It says, I just flew into town from Fairbanks and went directly into quarantine. There were some signs. I was surprised that there was not someone at the airport to alert arrivals on city expectations and guidelines and check quarantine plans. I think people want to do the right thing for Cordova, but don't necessarily know how. It would be very easy to assign someone this task, and I believe it would go a long way to ensure compliance and protect Cordovans even before the big seasonal influx starts. Thank you for all the work you're doing. I've heard that a number of times, and it certainly on the surface of it seems like a very good idea to make a bigger deal as people disembark about what's expected regarding quarantine and that kind of thing. So, good letter, Rita. Ellen Americus writes to the council, I would like to correct my comment about shutting down the fishery. I support local fishery. I think we should limit incoming to emergency personnel. And that's been, incidentally, if you've been keeping up on the chatter, as I call the electronic communication between people, early on, there were some people that were saying unequivocally, shut the whole thing down, that Cordova has basically gone without a fishery, and I don't remember what they cited, if it was the earthquake year and certain other big things that have happened. The spill had a big impact on the fishery that year, of course. People had been saying we've had a year here and there in our past where there hasn't been any fishing, and this might be a good year to consider that again. That perspective has evolved into trying to consider a co-op alternative or something involving locals. I don't know the ins and outs of that, to be honest, but it's been interesting to see that develop, and that's why the conversations are good. There's some growing pains and some reactionary ideas that get tossed out in the early phases, but it's very interesting as an observer, which is part of my job, to see how these ideas evolve. Now, Luke Borer writes this to the City Council. Mayor and council members, I talked with the governor's office, specifically Angela with Constituent Services. She told me I could quote her. She told me the small community travel order is what it says. A small community may completely restrict travel into the community with the exception of the 3 exceptions listed in the order, those being first responders, law enforcement, and Office of Child Services. Essential workers such as commercial fishermen and fish processors are not included in those exceptions. She looked up Cordova and stated that we're listed as having 2,200 residents not connected to the road system, and Luke says he asked about AMHS, and she, Angela with Constituent Services, said that doesn't count. And she also said Cordova does not have a native hub hospital, so we qualify under the order. She said the state will not do it for us. The community, with whatever form of government we have, must decide the level of access, and that we could apply it to the fullest extent allowed by the order. When I repeated the mayor's comments from the council meeting and radio show, she wanted to know who the mayor talked to at the governor's office. Now, again, this is Luke Bohr's letter. He goes on to say, I told her we were not asking to close the airport. I told her that the people I am working with are not trying to be unreasonable, that we are trying to do what the federal government and world are telling us, and that is to isolate. She said she agreed with me, and that is what the governor is saying also. I told her we believe we can isolate Cordova and still have a fishing season accomplished by those that are already here, and that we aren't advocating no fishery at all as long as it's done with people already here, and health safety must be a primary concern. Now let me do a quick sidebar here in that, again, there were calls for that a while back. I don't know if those are still circulating around, people that are saying the fishery should just totally take a year off or not. I haven't seen any of that recently, but that was a perspective being put out there for a bit, but it seems to have evolved past that, and Luke is saying, again, that the people that he's in communication with are not saying shut the whole fishery down. Continuing with the letter, Luke says, Angela said she would check around the governor's office to see if someone had said something different and assured me that if she found different, she would call immediately. As of the time of this email, she hasn't called. I would have gotten this to you earlier, and then some personal stuff, and gives a phone number and so forth. And these letters, by the way, this is all correspondence that's in the packet. So again, if you want to read any of this for yourself, you can download the packet from our Facebook page or from the city website. Now, here's a letter. Actually, says it's an open letter to the Cordova community regarding COVID-19 from the Pacific Seafood Processors Association. So this would be sort of a different perspective, I suppose, maybe from Luke's. Dear Cordova community, along with the rest of the world, the Alaska seafood industry has been coping with the fast-paced nature of the national health pandemic created by the exponential spread of the coronavirus. Like you, we are very concerned about what the coronavirus pandemic means for our families, neighbors, and livelihoods in Alaska coastal communities and the Alaska seafood system overall, both in the short and long term. Our primary focus, and again, this is the Pacific Seafood Processors Association speaking, our primary focus is the health and safety of all of our partner communities, including Cordova, where many of our processing workers, fishermen, and their families live and work. PSPA member Trident Seafoods operates in Cordova and has been communicating with community leadership as to their progress in mitigating risk of their operations and has committed to sharing completed plans with the city and the emergency management coordinator. The safety of the residents of Cordova, fishermen, and processing workers is of the utmost concern. The state of Alaska has issued several health mandates to prevent the spread of COVID-19, several of which are directly related to travel in and out of Alaska communities. The state of Alaska has mandated a 14-day quarantine for residents, workers, and visitors upon entering Alaska, that's Mandate 10, and prohibited in-state travel between Alaska communities through Mandate 12, unless it's to support critical infrastructure or for critical personal needs. Since fishing and fish processing are considered part of the critical infrastructure workforce, workers entering the community can begin work immediately while under quarantine as long as a plan is submitted to the state of Alaska outlining how these workers will avoid the spread of COVID-19 and not endanger the communities in which they operate. To be clear, this does not mean that seafood workers coming into the community from another location are exempt from 14-day quarantine rules, only that they can work during the 14-day period while following the company's self-isolation and COVID response plan protocols. If I can step out for a sec, this is the same thing that CDFU has been pushing. They say very clearly, nobody in the fishing industry should take the critical infrastructure part of the mandate to mean that you can just do whatever whenever. I'm an essential worker, therefore I can walk around and I can do anything that I want. The exemption only covers you getting to work while you're at work, getting home from work. Other than that, everybody does the same things as far as quarantine, social distancing, masking, all that stuff. That's important for anybody in any of the critical industries to understand. It would apply to grocery workers and hardware store people and any auto parts and anyone. And this paragraph from PSPA reinforces that. Continuing with the letter. Seafood processors and fishing vessels are submitting plans to the state of Alaska in accordance with Health Mandates 10 and 12. These company plans are informed by medical experts and detail the measures that companies are putting in place to best achieve compliance with CDC guidelines, avoid the spread of COVID-19, and minimize risk to community residents. As our individual member companies develop response plans, their goal is to keep healthy people healthy. This means implementing screening protocols for incoming employees, detection and quarantine protocols to identify and contain any suspected case of COVID-19, new cleaning, disinfecting, and sanitation standards, and best practices for distancing standards. Our member companies have also been participating in a seafood industry work group for several weeks that was formed in response to the COVID-19 outbreak called the Alaska Fishing Industry, Safety, and Health Committee, or the AFISH Committee. Nice letter combination, by the way. AFISH. What is that, an anagram, a mammogram, something? I forget the word. Anyway, the AFISH Committee. Subcommittees and task force groups are organized across multiple functional topics and between participating regions and locations. This committee includes over 150 industry participants, health practitioners, and community leaders, all working to gather and share best practices in response to COVID-19 and to develop guidance protocols for vessels and onshore processors. These guidance protocols were developed with a medical risk management company that specializes in commercial, maritime, and remote work sites, and it's all posted on the state's website. Most urgently, we recognize the need for rural community healthcare systems to be better equipped to meet the needs of communities, and our companies are working on solutions to this problem. For example, Trident Seafoods is staffing its Cordova facility with a nurse practitioner and a fully stocked on-site clinic kit. In the coming weeks and months, PSPA will continue to closely monitor the situation, share information, and support measures that protect the health and safety of Alaska communities. PSPA will also remain constant in our advocacy to the state of Alaska for FDA-approved rapid point-of-care testing as a critical tool to assist with early and accurate detection in remote communities, including those with essential critical infrastructure industries such as the seafood industry. We recognize the considerable stress and uncertainty that the current situation has placed upon Cordova. We are dedicated to doing our part to keep the communities in which we operate safe. We're committed to working with community leaders in all of the locations in which our companies operate and the state of Alaska to get through this together. Please contact us if you have any questions. And that's from Chris Barrows, president of the Pacific Seafood Processors Association. This letter, again, is in the City Council packet if you would like to read it for yourself. And of course, people will continue to have varying opinions on whether they find something like that reassuring. I, of course, will leave that for you to judge on your own. We just read it. Now, an opinion from Carl Becker sent to the council. After reading an account by a doctor intubating and treating coronavirus patients on ventilators, I know that Cordova is not capable of handling patients in crisis with that disease. We must do everything we can to prevent coronavirus getting into our community. Antibody tests have limitations but can be used in conjunction with PCR tests that screen for the virus itself. Time is of the essence, and unfortunately, current PCR tests involve significant delays in processing the samples. We should be wary of spending $250,000 on antibody tests without verifying the source, working with our doctors at CCMC in Elonka, and possibly contacting the FDA. And then he cites some articles. Now, again, just as an observer, I thought that Dr. Hanna said we are capable locally of handling patients in crisis with COVID-19. So I'm not sure what Carl's source is for that. I'm not saying he's wrong. I seem to remember hearing differently from when we had our meeting on Friday with the team. But that would be a Dr. Hanna question. Letter from Bill Lindau to the council says, I read the recent article regarding discussion of purchasing antibody testing kits, that is, for coronavirus. I'm intrigued by this idea, and from what I've read on the subject, I encourage you to pursue it. As summer progresses, this testing could allow the city to return towards normal operations much faster and more safely. The cost is high, but if we're required to purchase 50,000 test kits, we should easily be able to sell our excess kits to other communities, even within Alaska. Cordova would perhaps need 10,000 to 15,000 kits, ? Please gather as much expert advice as possible on the subject in a short time and make your decision. So, two different perspectives on that. And again, this is good. Different people sharing different ideas on, doing their research. And, of course, the ultimate decision needs to be informed by medical doctors, but community input is important in the public process. So I'm glad to see people are writing. And then one more letter from Carl Becker here. Please pass this comment on to the mayor and city council. Visitors arriving by air should put on a mask before they enter the terminal. That would help prevent an infected individual from transmitting the virus. We should also wear face masks when entering confined areas where we will be in close proximity to other people. And Carl's opinion there is completely supported by recent guidance from the state and by the CDC. The idea of trying to get people to put on a mask as they enter the terminal seems like a very good idea. I don't know where you get the masks or, as usual, how something like that gets enforced, but that doesn't mean that you don't give it serious thought and maybe try it. And those were two opinions about the airport. First off, trying to station somebody out there who can let everybody know what the expectations are, other than just relying on signs, but actually having a person, I don't know, with a bullhorn or whatever, to explain what's expected. Maybe as people are coming off the plane, or I don't know how it would work, but some way to put that into practice seems like a good idea. And then trying to find a way to mask people. So if they're coming off the plane and they have it, whether they're symptomatic or not, you greatly reduce the chances of them spreading it to somebody else through sneezing or coughing or even talking. And there's a video, I don't know, I don't have a link to it. Maybe if I can find one, I'll stick it up on the Facebook page, that shows, it's one of those slow-mo videos where it shows a person coughing in slow-mo against a black screen. Shows a person coughing with no mask, and then compares that to a person coughing when they have a mask on. And it's a pretty striking demonstration of how effective masking is. Not to mention, from sort of a people helping people standpoint, making the effort to wear a mask when you're out and about, especially if you have to be indoors somewhere where other people are. You not only send the message that you care about about making sure that you are not a contributor to the spread. There's that message. And then, but also, I think, and this is just my opinion, I think there's value in, saying, just basically you're making a public statement that I'm aware that we're in the middle of a pandemic. I'm aware it makes people nervous. There are people that are scared of catching this, even if it's not a risk to themselves, that they may, if they catch it, they may pass it to somebody who's vulnerable, a senior or somebody with a compromised immune system. You kind of are saying, I'm aware of all of this stuff. I'm aware people are nervous. I'm going to be sure I wear my mask, even if I feel funny about it, because it's we're Americans. We don't do that a lot. And it's a shame, really. There are a lot of people walking around not wearing them just because they feel funny. I know some of them. Oh, I don't want to do that. I'm going to look weird. That's not an undefensible position entirely, but you wonder if this really is one of those unique times where any of us that feel that way should try extra hard to set that aside, particularly because the more people that everyone sees, particularly the nervous people see, wearing the masks, the more you have a sense that the community is on board with being safe. So I would like to encourage people to think of a mask not as, a sign of fear or weakness, but as a sign of community empowerment, as a sign that we're working together, if that appeals to you. Now, on the flip side, as we said Monday, masking is not mandatory. It may become mandatory at some point, but it isn't mandatory. So that doesn't give anybody the right to give somebody a verbal beatdown for not wearing a mask. If you see somebody, in the grocery store or something, they're not masked, you really don't have the right to go up and say, you don't care about the community, you're blankety blank, blanky blank, and I'm going to blank and call the police, and you're blanking, killing people, and blankety blank blank. That's out of line, and that's not part of being a good community either. So we don't go around stabbing people that aren't wearing masks with pitchforks. You can certainly, in an encouraging way, suggest to them that they consider it, and even if you know somewhere where they can get one of these homemade masks, let them know that they're available. Because there are going to be people that aren't masked that just aren't because they're not aware of it. And that's where the education is helpful. And then you're going to have your genuine buttheads who just don't care about anybody else, period. They're going to do what they want no matter what anybody says. And, I don't care if I get people sick. I'm going to do me. Okay. But back to the point. I think that the more of us that mask up when we have to be out, the better a message we are all sending to each other as a community, that we care about one another. And I think the more masks you see, maybe it'll be triggery for some people, I don't know. But for me, the more people I see wearing masks, the more that says to me, hey, I get it. I understand these are unusual times. I'm going to make sure I don't give you this disease, and I want to show support and solidarity with people who are concerned about the spread of it. So for what that's worth, that's where we'll call it. And we thank you for joining us for the town meeting program here on KLAM, brought to you by Cordova Wireless Communications. They and CTC are invaluable sponsors of local radio. I mean, there's a whole lot we wouldn't be able to do, including just keeping the transmitters operating, frankly, without their help. And this show, in case you missed any of it or want to hear it again or share it with anybody, will soon be on our YouTube channel. Cordova TV is what Robbie calls it, and the address youtube.com/Cordova TV. Hope everybody stays safe. We're going to continue to do what we can to keep you informed. If we can get a good recording of today's meeting, we may share that later in the day, or at least make sure it gets up on the web. I'm sure the city will be posting it. We may post it too, so it's easy to find for any people that are using our YouTube page as a way to stay up to speed on things. But again, let's all keep thinking. Let's share good suggestions, work toward community solutions, take care of one another, stay safe, wear your mask, don't be out if you don't have to. And as the experts keep saying, we will get through this together. Thanks again for listening. We'll see you next time.